Journavx is a new drug. Suzetrigine. This drug took 25 years in the coming. It's been 25 years since there's been a new pain management drug. What have we used before? Well, we've used drugs like opiates, hydrocodone, oxycodone, codeine, morphine. Those drugs, what were the problems there? You know what? To be honest, those drugs work 5 days and then tolerance develops. They're addictive. They overdose, respiratory depression. They're just not great drugs for pain. Motrin, ketoprofen, ibuprofen, all those nonsteroidal anti-inflammatories. Aspirin was another great class of drugs. They work for pain, but they rip your gastric mucosa apart, causing gastric ulcers. They're very rough on the kidneys. They can cause kidney damage. You know, Motrin, you think, oh, this is such a benign drug. No, it's not. It's very nephrotoxic, meaning it decreases blood flow to the kidney in the outer cortex, like a kidney bean in the outer shell. It cuts off the blood supply to the kidney, causing kidney damage, and basically your kidneys could shut down from it. They're not safe drugs. They work great. And then there was the Tylenol, acetaminophen class. Well, we know the problems with that. It shuts your liver down, very hepatotoxic. And Tylenol can cause a lot of stomach upset and nausea in a lot of people. So we basically had those three classes of drugs. And they worked, but they had their problems. Now there's a new class, Suzetrigine. This new class is totally different. One hits the opiate receptor with the opiates. One was a prostaglandin type drug, the Motrin type drugs, the nonsteroidal. And the other one was acetaminophen. Unclear mechanism of action there. This new one just works in the periphery. It blocks sodium-gated channels called 1.8 voltage channels in the periphery. So it only works, it doesn't go in your spinal cord and your brain. It doesn't act central actingly. So that's great. Does it work? Well, I read the studies so you don't have to. They did studies on people. The two of the studies that went before the FDA were on people who had bunions, little bone spurs on your foot, and abdominoplasty, women who had excess skin on their stomach after a childbirth. And they did placebo, suzetrigine alone, and suzetrigine with an opiate. And yes, it's separated from placebo. It treated pain. I think it treats pain as well as nonsteroidal anti-inflammatories like Motrin. And in the opiate class, people needed less opiate for pain. It's indicated for short-term use, acute pain under 6 months. It appears to be effective at this point. And let me qualify, everything I'm about to say may change in time. So let's just say if this video doesn't age well, I'm giving you a warning. It hasn't been used long-term, and I'm going to run through some side effects and everything. So people take it. It has a half-life of like 23 hours. It has an active metabolite with like 43 hours. It kicks in 2 to 4 hours. It's taken only orally. It's in an enteric-coated capsule, so it's slow release. It kicks in, and the pain is down. Its peak plasma is like 4 hours, so it works pretty rapidly, pretty effectively. Side effects. Well, from what I can see, a little nausea, a little GI upset initially, but it goes away after a week. Some people complain of dizziness. That usually goes away. Some people complain of a tingling, burning, numbing feeling in their hands and feet, usually their extremities, but it's only in the periphery. It may cause insomnia, and it may cause, what a bummer this one is, impotence. That's not good. And what are the key areas it treats? It treats post-surgical pain, but they're thinking it does nerve pain, like neuralgias or shingles or herpetic neuralgia. It worked for the post-surgical pain in the bunionectomy and the abdominoplasty, but not as well as the opiates, but it helped. They said in neuropathies like diabetic neuropathy, it didn't work as well as Neurontin, which is gabapentin, but it worked. So it's treating pain. It's on a spectrum. I'm not saying it works as well as opiates, no. And I'm not saying I think it works as well as Motrin, ibuprofen, or Tylenol, acetaminophen. So that's good. It has these side effects. What are the potential for abuse with this drug? And I looked on Reddit. I scanned all the different abuse attempts, anecdotal reports. Someone tried to shoot it, and all that happened was his arm got numb. Someone took an overdose and just had tingling in his extremities and a little bit of numbness, nothing. It appears very safe in overdose. It's not habit forming, it's not addicting, it appears safe in overdose. You don't develop tolerance. It doesn't affect the gastric wall, it doesn't affect the liver. It's metabolized in the kidney. It may have some effects on the kidney, so hydrate when you take it, but the effects on the kidney appear minimal. So it works in a nephropathy and diabetes, acute pain under 6 months, in post-surgical pain, works best in viral related pain where herpetic neuralgia like shingles. That's an excruciating pain. This works great for shingles. So this drug will have a use. I'm thinking it will have a use in, I don't think extreme pain. I'm not clear if in severe chronic pain conditions it's going to work, but it will work. Post-surgical pains, which are minor, neuropathies, herpetic neuralgias. So that's where I see it fitting in. I see it also being used in a stacking when someone's on opiates and the opiates aren't working as well as they used to. And instead of increasing the opiate, add this to an opiate. And it looks like it's pretty safe. And I've had people try to vape it, nothing, just bloody nose. I've had overdoses where they tried to get high in it, no effect. They just got sort of numbness and tingling. I've had people try to shoot it. They get infections from the cut in it and numbness in the arm. I've had people try and drink on it, and that causes a burning feeling and exacerbates the tingling, burning, numbing feeling in the extremities that it's caused by Suzetrigine. Overall, I think it's a good drug. I think it's a new class of drugs. I think it's a new tool in pain management. This is not a copycat drug. This is something new, a new mechanism of action. It hits these sodium channels only in the periphery, does not enter the CNS. This, I'll give this company credit. They put their work in. This is something new. Now I pray I don't eat these words and then you're going to find that this is doing something horrible to the kidney, where 80% of the drug is excreted in the kidney. Yeah, part of me is worried about that. I'm worried about the kidneys. But it appears very safe at this point. The expense, it looks like it's $15 a pill. GoodRx, it comes down. So you're getting the pain management of Motrin, and you're probably talking $500-600 a month for the drug if you're going to take it for the month. Nothing else comes to mind. If anyone knows of anyone who's abused or done anything wrong with this drug, please let me know. Because I have not seen anyone capable of doing it this time. After seeing people vape it, shoot it, snort it, put it up their rectum, I haven't seen any bad outcomes, and I haven't seen anyone get high or abuse it successfully. They've tried, but it's not happening. Thank you.